Welcome, everyone, to Understanding the Human Condition. I'm your host, Dr. James Flowers, and this is my lovely co-host, Robin French. Hey, Robin.
Hey, you.
How are you?
I'm good. How are you?
I'm doing great. I am so excited.
I know.
Today, we're joined by our very own primary therapist, Arti Patel. Hey, Arti.
Hi, I'm excited to be here.
We're so glad
excited
that
to
you're
have
here. It took a little tooth pulling to get you here. But Arti was a little nervous about coming, and I said no one could be better to talk about attachment theory,
Right.
Yes.
which is today. So
Yep.
I'm so in. Let's jump right into today's topic. What is
Yes.
attachment theory?
So attachment theory can be explained by the emotional bonds that we have with significant others, and it really starts during infancy. The care and the bond between the caregiver and the infant, but not just the quality of care. A lot of it is nonverbal
Right.
and emotional space too.
Absolutely. Very nice.
Now, what are the different attachment styles? Because, and I have to admit, I am new to all of this. I'd never heard of this
Yeah.
before.
Yeah, right.
I
Why
didn't
would
realize
you?
this
Yeah.
existed, but it's fascinating. So, what are these different attachment styles? Can you
Yeah,
describe?
so it's very fascinating to me as well as I do my work in this. So there's 4 different attachment styles. And the first one is secure, so trusting, independent, but still being able to express how you feel. And the second one is dismissive avoidant, aloof, not feeling comfortable sharing how you feel. We can be avoidant of feelings, even though they're within us. We can feel hurt or rejected. And then anxious or preoccupied, we need constant reassurance from partners or people around us, right? Or we want intense connection all the time and can't get enough
Sure.
before the other person's ready. And fearful avoidant, it can be a combination of avoidant and anxious as well.
Can someone have 2 or 3 of these?
Absolutely.
Oh, good
Yeah.
question.
That's what I see.
Oh, wow.
Yeah.
Yeah. So, if you can, discuss the importance of our comprehensive diagnostic evaluation and why understanding your own attachment style is important in our lives.
Yeah, absolutely. So it's very important because we can understand how we felt as children because that developmental lifespan is so important.
Yep.
And our childhood experiences do shape us.
Right.
And it does carry over into adulthood and how aware we are
Yeah.
about those experiences as well. And I have a lot of fun when we're doing the biopsychosocial, getting to know our adult patients or even our younger ones, just going through their experiences and hearing them talk about it is
Sure.
awesome.
Absolutely. I'll throw this in real quickly. That's kind of, we weren't planning on talking about this, but listening to you just reminds me, you're getting ready to see a patient within our practice that was born at 24 weeks, right? And weighed 1 pound, 1 ounce at birth.
Yeah.
And she had no physical human connection or contact with her mother, father, or really anyone else for months. Do you
Yeah.
think that affects a person's attachment style today?
I'm sure it has some impact
Yeah.
on her, and especially
Yeah.
with both, right? The caregiver and the infant were both impacted
Absolutely.
by that.
Yeah. Mom as affected probably as her. Yeah.
So, basically, if your needs weren't met as a child, does that mean that you can't foster healthy relationships?
Absolutely not.
Okay.
Through healing and having corrective experiences, you can most certainly foster healthy relationships. It's, if we can validate our own experiences and practice that self-compassion, we can have healthy relationships.
Yep, absolutely. Yeah. How do you use attachment theory to help clients at J Flowers?
Yeah, so holding space for them, holding space for them to feel safe
Yeah.
and to be able for them to share their emotions in therapy as well,
Sure.
and how important that is. And I think
Yep.
the beauty of that is, too, that we all work as a team together and
Yeah.
our team is secure.
Yeah.
And I find that awesome because we can all work
I
together.
think it's so important to the process. Yeah.
I hear
Yeah.
that a lot,
Yep.
because I've done a lot of those client satisfaction surveys. And the one thing that I hear over and over and over again is
Right.
that they made me feel safe
Yep.
and heard
Yep.
and
Yeah.
understood.
Yep.
And I also think that a lot of it has to do with the fact, I don't know if people know this or not, but you serve these concierge lunches to all of us, and we all do this buffet style where we
Sure.
sit like a family, therapists, administrative folks, the clients, and it's just even more opportunity for everybody to bond like a family, and I
Yeah.
think it makes them feel safe, right?
Sure. It sure does. Absolutely. Yeah.
Yeah.
So I wanted to ask, can you be single and work on your attachment style?
As in single, as
course.
in not dating, Robin?
Yeah, exactly.
Of course you would ask that question.
Yeah,
Yeah.
of course. So the relationship we have with ourselves is the most important relationship, right? So even when you're in a relationship or not in a relationship, we have to constantly do that inner work. And that can change for everyone, and that inner work can be really empowering for us.
Yeah.
Yeah.
Yeah. And we were talking about that in the car, actually, how we aren't the same people that we were when we were 20, when we were
Yeah.
30. We're, you know, we do change, and we should change. We should always work on ourselves.
We're evolving human beings, right?
Absolutely.
Yeah.
So if someone is in therapy, or even for those listening that may or may not be in therapy, how do we learn about our own attachment styles? How does someone learn that? Is it only in therapy? Is there something they can read?
So I say come to J Flowers
There you go.
because of what I
Okay.
said before about
Yeah.
how we have a team of therapists. And
Yeah.
so the nice thing is that everybody has a primary and secondary therapist.
Right.
And I find, we're working together in sync because we're training together and, we're talking about each patient. So that's really wonderful.
Sure.
And helping them understand what that therapeutic relationship is like
Right.
and what their style is like, so they can also use that in their interpersonal life as well.
Yep.
And there's a wealth of information and literature on attachment styles.
Good.
And
yeah. What made you become interested in attachment theory?
Yeah, so I've always enjoyed working with young people. I've worked in residential with small children to young adults to adolescents.
Yeah.
And I realized how impactful attachment can be and the relationships that they have with other people.
Yeah, absolutely. I think it's so critical to understand that piece in the therapeutic process. Yeah.
Now, how can a parent, for all these parents that are listening and are watching, how can they create a secure parent attachment style or environment for their child?
Yeah, so holding space for feelings and that their child is not wrong for having strong feelings.
Okay.
Right? That we're not inadequate for having strong feelings, and that we can feel feelings that are strong that are not happiness and joy, because we want to feel a range of emotions. So helping a child understand that that's okay and that you can come to me with
Yeah.
these feelings.
Okay. Cool.
Yeah.
Yeah.
We see so many people in our practice and all over the country, really, Arti, with trauma,
Yeah.
the history of trauma.
Yeah.
How does what role does attachment play in dealing with trauma?
Yeah, so when there is trauma in childhood, right? That can be really hard, and
Yeah.
that can impact us in adulthood too. And sometimes we can go through more traumatic experiences. But if the child had someone they could turn to for comfort and someone who validated their experience, that can be a very healing experience as well.
Yeah.
The traumatic experience can be bad enough, but when left in isolation,
Yeah.
that can be worse.
Right.
Yeah.
And not only being left in isolation, but what happens if you have difficulty with attachment, right? And you don't deal with it in life and you're in a relationship? What do you often see?
A lot of avoidance,
Yeah.
right? Patterns of avoidance,
Yeah.
not being able to talk about your true feelings. Because what I say is there can still be connectedness even when there's conflict.
Right.
Right? That we want to
Absolutely.
improve the quality of conflict, because conflict is inevitable. It's going to happen
That's
in
right.
all relationships.
Yes, absolutely. Yeah.
Yeah.
You lead a self-compassion group at J. Flowers Health Institute. Can you tell the audience about the group and what that's all about?
Yeah, so it's been very rewarding for me just to see everyone sit in that group and process. I give them a feeling word list
Yeah.
and we check in. And the goal for me is that I'm doing less of the talking in the group, right? So if I can set the frame and talk about self-compassion, define what it means for them, and the goal is that they bond with each other. And even though everybody is unique in their experience, that they're having a healing experience with each other.
Right.
And to be able to see that has been extremely awesome.
That's
Yeah.
great.
Yeah.
Wow.
How can you help our audience understand a way that they can practice self-compassion?
Yeah. So taking inventory of our inner critic,
Yeah.
how we talk to ourselves, our inner voice, right? We can be really judgmental. And I think that's really important to change the way we talk to ourselves and being our own best friend. How can we
Right.
nurture and nourish ourselves?
Yeah.
And that's I think my favorite exercise for self-compassion, to kind of start thinking about those things, because we have
Yeah.
to train the mind. And as human beings, we need to hear things over and over again.
It's so
Yeah.
difficult. I go through that with myself, right? I'm
Yeah.
too critical of myself sometimes, and I think, oh, I didn't do that right, or why didn't I do it better, or what have you. And we can all practice this,
Yeah.
right?
Yeah, yeah. So what does attachment disorder look like in relationships?
Yeah, so I think we touched on that it can look like a lot of avoidance, right? And people who are not able to share how they feel with each other, and just people who are not talking about conflict and are also celebrating themselves too. That we have to learn to celebrate ourselves for our limitations and our strengths.
Yeah.
Yeah,
So
and-
I'm going to throw this question out there too. What happens if it's not diagnosed? What if you what happens? What's the end result?
Yeah, I think that can be really hard and can lead to a lot of pain and suffering for people if they're not aware, right?
Yeah.
Because pain and suffering is inevitable in life, but if there's no awareness or understanding, then that can be really hard.
I think what I see in relationships, and when we're talking about clients and patients in the office, when we see this and they're not aware of it, over time, things come out sideways,
Yeah.
right? In
Yeah.
conversations, whether it's with your partner, whether it's with your, whether it's with your spouse or a coworker or anyone. When we don't understand our own attachment theory or our own attachment style, I think that when we're frustrated or we're sad or we're angry, that if we don't understand that and we don't understand where it's coming from, it comes out sideways.
Yeah.
And it can really make things kind of blow up and be bigger than they actually are, right?
Yeah.
And it may seem like you're upset about one thing, and it can actually be something completely different, right?
Yeah.
And that we see those things. Yeah.
Right.
Yeah.
Yeah.
Tell me either one of you, like a really good story. Do you have a story to share with, success story perhaps with someone who was suffering with this? How they rebuilt and
Yeah, so I think one of my first clients who came in back in January was a young woman who was in her 20s, very smart, had gone to do her interior design certificate and had gone through a lot of trauma and had some attachment. And she really just soaked everything up. At J Flowers, we created the space for her, and all of the outside providers and also the therapy in-house. She just really took everything and just was able to practice self-compassion, understand her attachment style, and said that coming to J Flowers was one of the best decisions she made.
Yeah.
Yeah.
What have you seen in your groups that you do with attachment theory and patients recognizing when you kind of step back
Yeah.
and they take over the group? What have you seen positive come out of a couple of your groups?
Yeah, so just a lot of empowerment and a lot of vulnerability as well.
Yep.
And some of them, never even heard of self-compassion.
Right.
Or think that self-compassion is selfish.
Yeah.
So
Yeah.
we go over why that's not selfish, and it can actually help you be more compassionate towards others, the more
Right.
compassion you can practice towards yourself. And they're truly fascinated, and they come with a lot of curiosity. And what I hear them open up with, or how they tell their story, and how they can tell it in a way that's more compassionate towards themselves.
Right.
Instead of being shaming, has been amazing to watch.
And what I've also noticed in relationships is that if you have two members of the relationship that don't understand
Both
their
with it?
attachment, right?
Oh, yeah.
And one of them is doing work and they're learning
Yeah.
about themselves and they're practicing self-compassion, that the other spouse or the other partner is going, "You're being selfish. Why are you doing? You take care of me instead of you." It's like, no,
Yeah.
you go to therapy.
Yeah, yeah,
Right.
absolutely.
Yeah.
Yeah.
So, I think this is wonderful, and I love what you do with us, and thank you for working with us. And I love talking about attachment theory. But tell us more about Arti. Tell us about your background,
Yeah.
and tell the audience a little bit more about yourself and education, and what brought you into this field.
Yeah. So I've always been fascinated by psychology and attachment
Yep.
from a young age, even if I didn't have the fancy words for it. So I was born in Queens, New York, grew up in New Jersey,
Love it.
have strong Indian roots.
Yep.
And I never thought I would leave the Northeast.
Right.
And here I am in Houston, and I love it.
Okay.
And I'm so excited to be at J Flowers and to be able to do this work. It's been a wonderful experience just with the team here, and how we are pretty secure in our attachment with each other, how we can go to each other and serve our clients.
I think the most important question I have for the day is where's your Queen's accent? I don't hear that in
No
New York.
Jersey or
Yeah,
Queens.
right.
Yeah, no New
or-
Jersey or New York accent.
Exactly. That's right.
Well, Jordan wants me to ask what Arti thinks about your and my attachment style.
Oh, you're going to diagnose us. I think that's a great idea.
Well, I've listened to a few podcasts and it seems secure. It seems like
Oh,
you'll
man,
have a good
that's
flow.
awesome.
We're
Yeah.
healthy.
We fooled them.
She thinks we're healthy. Good job.
I did want to ask a question, though. We were talking about children and parents and making them feel secure and making them feel heard and creating that safe space. But how do you discipline a child who has attachment issues?
Yeah.
Yeah, that's really hard because it doesn't have to be one or the other. You can still validate their feelings and still hold a boundary.
Yeah.
Right? Yeah.
Yeah.
Yeah, absolutely.
You can, because the
Yeah.
discipline and boundaries are for safety, right? They're not for punishment. It's to create safety for them. And children are often, they feel safer with boundaries. They need
Oh, for
someone
sure.
to tell them, right? So
Yeah.
that's really important. That it doesn't have to be just because we're validating their feelings, it doesn't mean we're saying yes to everything.
Right,
Yeah.
right. And consistency,
Yes.
too, right?
Yeah.
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 And is this something generational that's passed on? Like, I've heard generational trauma, right? So, like, if a parent has this, can they be passing this on to, and it's going from generation to generation? Or
Yeah, and that can happen, but I do believe that each generation gets better, you know? I think that each generation does get better and has more awareness. And that's what I've seen too. And that we're really modeling that as therapists for people, right? To how to have a secure and healthy attachment. I would want a client to tell me if I upset them, right? And I would need to validate their feelings.
right,
Yeah.
right. Yeah.
So, in working with adolescents and their parents, have you ever sat down with a parent and talking about attachment theory, educated a parent on attachment theory, so that the parent then can then go home and talk to their children about it, right? Kind of educating their children about attachment theory, right?
Ah.
That just, I don't know why that just hit me, but
Yeah.
and maybe I'm wrong. But
Yeah, no,
yeah.
absolutely. I
Yeah.
think that's a really good one because at the end of the day, the parent-child relationship and the quality of that matters the most, right?
Yeah, absolutely.
Because sometimes we focus too much on the behavior, and yes, we do have to set boundaries and keep adolescents safe, but
Right.
the quality of relationship matters the most, and how an adolescent can go to their parent, express their feelings,
Right.
and how sometimes that gets lost, right? We
Sure.
live in the real world. People are busy with their schedules and school, so sometimes we can come really hard on the other
Yep.
stuff that's going on, right? So
Right.
just remembering that that the relationship matters the most. Yeah.
Have you seen any differences in, and I'm sure that you have, between children who are adopted and children who are born into a
question.
family, like at
Yeah.
different age groups?
Yeah, I have. And I think that really depends too on everybody's emotional capacity.
Yeah.
There's so many factors that
What the background
yeah,
was.
there's a
Yeah.
lot of different factors.
Yeah, absolutely. Good. Well, yeah.
We're
go
running.
ahead.
No, I was just going to say we're running out of
I
time.
can't believe how fast it goes.
I know, right?
It's crazy.
Yeah. So, Arti, what are your thoughts on understanding the human condition? What does that mean to you?
So that means to me our humanness and how connected we are. And I was thinking about this, about how our senses can greet our brain, right?
Yes.
And how we connect that all together.
That's a good way to
Yeah.
put
Yeah.
it.
Yeah,
Our senses
absolutely.
greet our brain.
Yeah.
Real quick before we go,
Yeah.
how do you take care of yourself? Because you do a lot
yeah.
of deep therapy all day
Yeah.
long with a lot of people, with a lot of trauma. How do you take care of Arti?
So I really enjoy my family and friends.
Yeah.
I love the sunshine. I love the beach.
Nice.
So those are my ways of taking care of myself.
And I think yesterday, did you all go to yoga?
Yes,
Yeah.
that was amazing. We did yoga, and that was wonderful. It was truly wonderful to be able to take out time during our workday
Yeah.
and leave and do yoga, and that was a nice bonding experience for our team.
Oh, that's so
Yeah.
cool.
Yeah,
Good.
that's one thing that you guys are
Yeah.
really good about is professional development and team building and
Yeah.
And that's a great benefit to working at J. Flowers Health Institute.
Did you go to yoga yesterday?
No, I didn't
you
get
have
to.
to
I think it was just the
practice.
clinical team
Oh, yeah.
yesterday. Yeah.
Nice. Good. Well, we'll have to go to yoga.
Yeah, no, I'm going to equine. I'm going to visit Melanie and do that equine
Oh,
therapy
nice.
on Friday.
That's great.
Yeah, so there's my field trip for the week.
There you go. Perfect.
Did
I
you
know.
go? You didn't go?
No, not yet. I will. I'll join.
Yeah, you were working out though. I know that.
Yeah, I did go work out. That's right.
So if anyone wants to reach you, both of you, how do they contact you?
Well, I think for both Arti and myself, if anybody has questions about attachment theory, call Arti at the office, 713-783-6655, or
Great.
just go to our website, jflowershealth.com.
Great.
Yeah.
Thank you, everyone, for spending time with us. I want to remind everyone watching that there's numerous platforms that you can find us on: YouTube, Apple Podcasts, SoundCloud, Spotify, Stitcher, and iHeartRadio. Please share this episode on social media or with someone that you think it would help.
Yes,
Thank
because
you.
Arti's a fantastic therapist. Come
She
see her.
is.
Yeah.
Yeah.
Thank you,
Thank you,
everybody.
Arti.
Thank you,
Thank
Arti.
you.
That was
All right.
really cool.
Yay.
And our comprehensive diagnostic. I want to remind everyone about that.
Are we still on? Oh, we are. No, what
Do you
we
want to talk
remind
about the
everybody?
comprehensive diagnostic
Come
evaluation?
on, this is Jordan.
Hi, everyone. I'm Jordan, and we're just going to remind everyone that the best path to healing is getting a comprehensive diagnostic evaluation.
Absolutely.
There you go.
Thank you, Jordan.
Thank you.
Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.